Probably the most bothersome thing when a person has an upper respiratory infection, especially if that cough were to linger. Now, there's a new paper out of Canada that shows that there's really no role, no benefit from using pharmaceutical agents when a person has a lingering cough. So let's talk about it. Hey everybody, it's Dr. David. Hope you're having a good day today. Being on the front line of dealing with infectious diseases, coughing, people are always coming to me because the cough is lingering. Fortunately, in my functional medicine, more holistic practice, at least very rarely do people want antibiotics. I know in most situations, most medical practices, give me antibiotics, give me antibiotics, give me antibiotics, when really there's no role there for almost any type of antibiotic, unless a person has a true documented pneumonia. But today we're going to talk about a few things. We're going to talk about why people cough, why coughs may linger, when to get evaluated for a cough, and what to do about a lingering cough. Okay, so let's first talk about why people cough in the first place. So when a person has a respiratory infection, there's one of two things that are typically happening. Number one, there is some mucus, there is nasal discharge. Obviously, it can come down the front of the nose and we can blow it out, but we can also get a post-nasal drip, goes towards the back of the throat and down towards the airway, and your body coughs to keep that from going into your airway. Another reason, there could be something down there, bronchial irritation, mucus, etc., that your body's trying to get up, and you're trying to expel it. So not just could be protecting it, but also trying to get it out of the system as well. Okay. Now, of course, there are other reasons, such as like when people have reactive airway disease or asthma, and there are people who have reactive airway disease that can be triggered by colds or that can be triggered by cold temperatures or by exercise. But there is also viral induced reactive airway disease where a person's asthma symptoms may only come out when they have a cough. And that's a little bit different in those types of people, especially if they're truly wheezing, may benefit from the types of medications as a post-lingering cough. If there is wheezing, they may benefit from the types of medications that are used for wheezing. Okay. But also it's important to remember that not all airway irritations, not all coughs are infectious. Okay. Of course, there could be irritation. A person could have reflux, where something's coming up the esophagus and into the upper part of the airway and can cause a person to cough. It could be irritating, could have some of that acidicness, make a person irritable and make them cough if it's irritating. Okay. But also, you can have it from allergies. Obviously a post-nasal drip or things can be not from an infection, but from an allergy as well. And that's, again, something different if a person's having a lingering cough with a history of allergies and these are their symptoms and it's the season. Again, maybe it wasn't the infectious disease after all, or it could have been both, but using anti-allergy medicines in that situations could be helpful. But if it's going to be helpful, it'll be obvious very quickly. So a person doesn't need to be on allergy medicines for 2 weeks to see if that's going to make a difference. They should know in a couple of days. Okay, there could be other things there. People could have polyps in their airway, polyps in their throat, and that could cause irritation, can make a person cough. Other kind of growths, God forbid, a tumor, that can happen. That is how some people do present with a cough. There could be medication reactions. There is like ACE inhibitors. Lisinopril is classic to know that, which is a blood pressure medicine that makes a person cough. And there's no reason for it except for that it's just a side effect. There are other medications as well. Okay, now in terms of why coughs linger, that's a little different. So first of all, let's define what is called what a post-infectious cough actually is. So most people, once you have a virus, within 2 weeks, it's gone. Okay, again, there could be all the mess left behind, the mucus, the spasm, all of the irritation. But so when a symptom lasts between 3 to 8 weeks, that's when we can start thinking of it as post-infectious. Okay. Now, when a person has that infection first, it does trigger the inflammatory system, the cytokines, etc., which cause inflammation, which can cause inflammation and irritation. Now, also, those cytokines, those inflammatory cytokines, can also cause like bronchial sensitivity, mucus production, as well as wheezing. And at the same time, as the time comes along, there may be some reduced mucus clearance, which means there's a little bit more building up. Now, it is totally normal for a person to have a cough for 3 to 4 weeks, as long as they're not getting worse. In fact, the interesting thing in pediatrics is it's not abnormal the first year that a kid's in daycare, preschool, kindergarten, where they're around a lot of other kids. It's very possible that they can pick up 10 colds in 1 year. And if it's okay for them to be coughing 2 to 4 weeks with a cough, and they're coughing 20 to 40 weeks out of the year, and of course, if you're a parent, you think that something was majorly wrong, might not be. This may just be part of your body's immune system, or that your child's immune system needing to get exposed to these different viruses, so that way down the line we don't get sick from them or minimally sick because we have the antibodies in order to fight them off. Okay. Now, of course, when a person is having this type of cough, it should be getting progressively better. If it's getting worse, something's wrong. After those couple weeks, we probably need to get checked out. But also, the airways themselves can become more sensitive after a person's coughing. So, sometimes a smell could trigger. I know for me, certain perfumes can cause a problem. Drinking something cold, that can make it happen too. Laughing. Have you ever had a time like where after you've had a cold for a while, and like someone tells a joke and like you're laughing, then turns into like a coughing fit? That certainly happens. Happens probably to all of us. And of course, with this, recognizing it can take a while to get back into exercise. So if a person is a really fit person and they're used to like just going crazy on their cardio, they may start coughing if they start doing their exercise too much. And it's really a good idea to take your time and ease back into an exercise routine, especially if you've been off of exercise for a few weeks. But even so, with your lungs, just make sure your lungs can handle it, and maybe go at 50, 75%, work your way back up. Okay, now a couple other considerations regarding prolonged cough. Pertussis, which is whooping cough. Okay, now with whooping cough, typically it starts off with cold symptoms for 1 to 2 weeks, but then it goes into this what's called paroxysmal phase. Okay, where after that first 1 to 2 weeks of colds, for then 1 to 6 weeks, they can go on to this first. There's a few symptoms. One's called a paroxysmal cough. This is a violent, uncontrolling cough. It's exhausting. It can be painful. You could pull a muscle in your chest. Okay. So, of course, if you're getting a violent cough 2 weeks after having sick, you got to be thinking pertussis. Even if a person's been vaccinated, if they haven't been vaccinated recently, vaccine protection wears off. So, after a couple of years, a person can absolutely get pertussis. It's not impossible, less likely, but it's not impossible after being done with vaccination. Okay. They can have what's called post-tussive vomiting, which means throwing up after cough. So cough, 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 puke. That's a common sign that's also seen in pertussis. And the other thing that they do is this inspiratory wheeze. So they kind of go through this cough on them. I'm going to do it lightly. I used to do a perfect job, and I think I pulled a muscle about 15 years ago and showing space. So it's kind of like a, and then it's a louder sound than that. But that's like the whoop is that inspiratory soft after cough, 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 cough. Inspiration. That's the inspiratory whoop that happens. Okay, and of course, as I mentioned before, a person who may have asthma, and even if they did not have viral induced asthma, it was one of the other forms, allergic or exercise or cold induced, temperature wise, they could trigger. Getting a virus could trigger them to have viral induced reactive airway disease, asthma as well. Okay, so when should we be getting evaluated? So first of all, in the acute setting with any cough, of course, if there's difficulty breathing or shortness of breath, not in the midst of a coughing run, but especially in between, or if you can't stop coughing altogether, that's a concern. Okay. And one of the other concerns is an increased respiratory rate. Now, depending on the age of a child or into adult, adults, really shouldn't be breathing more than 20 times per minute. Kids are allowed, a 1-year-old can be breathing still 40 times a minute, a 6-month-old, even more than that. So you have to look up to see what's normal for that particular age group. But of course, an increased respiratory rate typically means that the person's struggling to get the air in, and so they're taking more breaths in order to compensate for that. Okay. Of course, if a person's coughing blood, that should always be a sign that you need to get checked out right away. If there's any difficulty swallowing, that can be a sign that something pending is about to happen really bad. And of course, if you have a pulse ox machine and your oxygen levels are not up in the upper 90s when they normally are, that's a problem. That means that the body's fighting to get oxygen. Especially with young kids, things can go downhill pretty fast. So you do want to act faster if it's a young child, just in case, Okay. Now, a few other things. So if it does go more than 8 weeks, doing a pulmonary function test, which does check to see if there is reactive airway disease, of course, x-rays, etc. A lot of people also talk about sinusitis. Okay. And the interesting debate seems to be not so much among doctors who know what they're talking about, because the rule of thumb is that antibiotics don't do anything. This time isn't what needs to take care of it. In fact, going back even 28 years ago when I was in medical school, we were taught by the ENT doctors about sinusitis. If you diagnose somebody with sinusitis, if you put them on antibiotics, they'll be better in 3 weeks. But if you don't put them on antibiotics, they'll be better in 21 days, which of course is another way of them saying this is pointless. Why are we treating? Okay. Of course, if a person spikes a new fever, etc. The other thing about sinusitis, the color of the runny nose, that's a false thing. You can have any color runny nose with any kind of cold virus sinusitis. It's just not a predictable factor. But if after having a cold and things are getting better, there's all of a sudden a new fever, and especially if there's frontal headache pain, really severe pain, pain can also be down here under the eyes as well. Can sometimes there's what are called ethmoid cells that are sinuses in here as well. So if you're dealing with very severe pain, that too could be a sign of a sinusitis. It could be actual bacterial that needs to be checked out. But if it's just because you've had a runny nose for a period of time, that's not really likely a bacterial sinusitis and probably does not warrant to take an antibiotic. Okay, so in terms of this new systemic review and what to do about it, so this paper that was put out from in Canada, they did a summary of all of the randomized clinical trials using different types of medications, dextromethorphan, asthma puffering if you're not wheezing, steroids, etc. And they found that there was no evidence supporting pharmacological treatment for inhaled steroids, oral steroids, bronchodilators, which is what the puffers are, or oral cough medicines like dextromethorphan, the DMs. Okay, and they concluded there was just no evidence of benefit there. Most of the trials found that the cough symptoms did improve without medication. Okay, and what does that do? It highlights that recognition that the self-limiting nature of a cough, it's time. I remember Dr. Regenberg at Tampa General Hospital used to preach to us all the time, the tincture of time. She was the head of the pediatric residency program there when we were there. The tincture of time, the tincture of time. Know when you need to assess and when you need to make a further step, but time is the answer for most things. Okay. Now, there are some natural things that I think are safe and cheap that one could try if they need to. One of the things you probably heard about honey, and honey can be very helpful. Taking honey and putting it on a spoon and letting the person kind of like licking it off, giving it some time to kind of make its way through the oral cavity and make its way down is better than just doing a quick swallow of a shot. So kind of like a little bit of licking on it, letting it kind of through it down. Okay. And drinking hot tea with honey, of course, that can be very helpful too. The heat can help open passages up. Of course, if it's a child, make sure that if it's you don't want to be too hot or someone supervising. And then there's something is an old school remedy that I've been using for 25 years, and it can be very helpful. It's worked for me multiple times. Basically, what you do is you take a quart, of distilled water, and you boil it up with a tablespoon and a half of molasses and a tablespoon and a half of sea salt. Okay, once it's boiling, you take it off of the stove and do the old covering the head with a towel and breathing it in. Of course, if there's going to be a child there, the child needs to be sitting with an adult on their lap. Maybe they both put their head underneath it so that you can see what your kid's doing. Some people, if they don't feel comfortable with that, will make take a couple chairs and make a little tent with some sheets, and then just kind of sit the boiling pot in there. Maybe play some games, read a book, kind of like be a little bit closer to that. Nice thing about that is that it's dirt cheap. Once you can put it back on the stove and boil it back up, and you can use it many times throughout the day, although we like to change it out after letting it sit overnight and then make a new batch the next morning. Okay, so that's something that I find that can be helpful. It's cheap, and you're not going to get into trouble with any of that stuff unless you burn. So, of course, watching for burning. So overall, what's my summary? Coughs suck. Let's face it, they do. Something that none of us wish we had to deal with before, and something almost every one of us will deal with again. Okay? Know when to seek medical advice, like when we talked about. And again, tincture of time, most important thing that you can do in almost every coughing situation, wait it out. All right. Hope you learned a thing or two. Have a great day.